Hello and welcome to today's webinar on conversations about dementia. We're going to be talking about communication and understanding. Thank you very much for your time today, and I hope you get lots of information from today's session. My name is Donna Pettigrew and I work at the Sydney North Health Network. I'd like to start today's webinar by acknowledging the traditional custodians on the land that we are all sitting today, and pay respect to their elders past, present and emerging. I'm going to give you some introduction on the Northern Beaches Dementia Alliance. It was formed back in August 2018, and it consists of aged care, dementia and healthcare professionals, as well as community members and people living with dementia and their carers. It's a partnership between the Northern Beaches Council, Sydney North Health Network, CCNB, RSL Lifecare at Home and Just Better Care Northern Beaches and Northern Suburbs. The Alliance aims to create a dementia-friendly community on the Northern Beaches to support people living with dementia to have a higher quality of life and to be understood, included and accepted. This forum consists of online webinars weekly for 5 weeks. This is the second in the series today about conversations in dementia, communication and understanding. So I'm going to introduce each of our it's not really speakers because we're having a conversation, not a presentation today. I will just firstly explain a little bit about each of our people that are talking today and why we've asked them to be involved. So Michele, wave to everyone, Michele. That's Michele. Michelle's worked in community care support since 2004 and has lived experience as a carer of someone living with dementia and someone with a disability. So she has insight into the experiences of both carer and the person themselves. She currently volunteers on the board of Carers New South Wales and works as a team leader for Dementia Australia. Fiona, give us a wave, Fiona. There we are. So Fiona Jenkins is the DCaf Connections founder and program coordinator. In 2018, Fiona created and set up the DCaf weekly social cafes, formerly known as DCaf Dementia Cafes. So these are within the Northern Sydney area for families of people living with dementia. She continues to run the original DCaf Cafe, which was renamed DCaf Connections in 2020. And that's within the Hornsby-Ku-ring-gai area and includes monthly carers conversational cafes. My own experience is as a registered nurse and having worked in aged care for about 10 years and also having had several people in my family with varying degrees of dementia over time. So we've all had quite different experiences, but we are really keen to talk and talk to each other and hear what you guys have to say as well. So one of the things that we are wanting to talk a bit more about, one of the aims that we're looking at with the Dementia Alliance is for people, make sure people have somewhere that they can live and be supported by their community. We want a place where people that are living with dementia are understood, included and accepted without a stigma associated with dementia. We want a place that provides opportunities for social participation for people living with dementia and their carers to reduce the social isolation that dementia often brings. And we want a safe physical and social environment for people living with dementia. When the Alliance first started talking about doing this series, we really wanted to talk about some of the difficulties that families have, or when someone in the family has got dementia, and some of the things that happen to people over time. So I'm going to start off by just asking. I'm going to start potentially with Fiona, if that's okay, Fiona. What sort of things do you think people might encounter when they come across someone in the early stages of dementia? So if you didn't know someone had dementia and you were in the shop or in a supermarket somewhere, and what sort of things do you think that someone might notice about if someone was in their early stages?
Thank you, Donna. One of the things is they will come across somebody who looks just the same as you and I. There are no physical indications that the person may have dementia, may have some cognitive issues. So one of the things they can pick up on is they may find that the person is looking confused. They may find that the person is a bit disengaged from the conversation and perhaps the people around them. There are so many very subtle indications. It could be that they're repeating their questions. They may take a little longer to actually process the information that's given, and maybe take a little bit longer to form the answers that they're trying to give or requests for information. So there's those things. They may also be showing signs of being very anxious. There could be anger issues, anxiety as they're trying to communicate. And it could be between the person with dementia and their carer, or it could be between the person with dementia and whoever they're interacting with within the wider community. But all these things are subtle.
Yeah, and I think it's that subtlety that can make it a bit confusing for people who aren't necessarily in know. And I think we've got to remember that sometimes people themselves don't necessarily know that they're in that early stage, because dementia can take such a long time to develop. And it might just be a little bit of forgetfulness, as you say, too. Michele, what are your thoughts around that?
Thanks, Donna. Yeah, look, absolutely the same that Fiona's already said, but sometimes, I mean, you don't know if a person is living with dementia. It's not an obvious thing, but sometimes there are some obvious things, like a change in behaviour or difficulty doing normal things. And I'll give you an example. You might encounter somebody in the bank who's really struggling just to do those basic processes in the bank. So whilst there are sort of a difficult task to understand, you know, how much money you've got in the bank, you know, even the simple processes of getting into the bank, you know, asking for help, you know, that can sometimes be very challenging for someone in that early stages who's going through that transition of not knowing why things aren't working. And, you know, those things that we all take for granted can be quite distressing for somebody in those early stages. Other things that I can think of are like being confused about time or place. You know, getting lost is a classic example. You know, even when you're not living with dementia, you can sometimes lose your car in a giant car park. I mean, if you've ever been to Warringah Mall, you know exactly what that's like. I think too, sometimes driving can be an issue in the early stages of a person's diagnosis. You know, missing appointments. You know, there might be, you know, not being able to really keep track of those things, even with diaries and stuff. I mean, those can go missing as well. So it's really easy to get into all of these different things. I mean, there is so many behaviours and so many things that could potentially point to that, but isolated and on their own, they don't necessarily indicate a whole thing. But when you look back over these things, they form part of that big picture that you say, oh yeah, that was an aha moment, I remember that, or you know, particularly when you're sort of dealing with somebody, a family member. And I think too, when I look back at my own mother's journey, I look at her change in appearance, you know, her inability to continue that grooming and personal hygiene stuff. That was a real telltale sign for me.
Yes. I remember a time too with my grandmother, who met us all for lunch every Thursday at the same cafe. And then all of a sudden she didn't turn up one day. And it was literally because she forgot it was Thursday and had gone to the dining room where she was living and had lunch there. So all of a sudden we realised we were going to have to start reminding her or picking her up and bringing her with us, but she liked to walk. So, yeah. The other thing, you know, you said about, you know, we all lose our car in the car park sometimes. The other thing that seems to happen to me a lot is if I go into a shop and they've changed, like if the supermarket changes where things are, and that's concerning for me without any memory loss issues. And I think, you know, if you walk in and the bread's always been there and now it's not, it can be quite confounding for somebody that is struggling with their memory.
Yeah, definitely.
You mentioned the diary thing there before, Michele, and I know a lot of people use that method just to keep them on track, even if they don't have a formal diagnosis. Some people will use that as a tool to help them, and that diary becomes very important to that person to try and keep them on track. That's really only when someone who's acutely aware that they are forgetting things.
Indeed, yeah.
And there's a lot of people who are not necessarily aware that they're forgetting things as well. So that's a whole different story. But there are there's lots of people who try different things to help them along. And I like your point about the people who live on their own. So they don't notice that they're forgetting things because they're on their own. It's often people who are living with someone else that notice that sort of thing. Okay. So what sort of things do you think, and I'm just looking through my questions very briefly, and we have talked about some of the examples. What sort of things could we do as just a community member or a family member or a shopkeeper? What sort of things could you do to assist somebody who was clearly struggling? Fiona?
Okay, if we went first of all to community members, things that they can do is patience. Give that person that little bit of time to gather their thoughts and to be able to present them. And if they forget a word, maybe suggest a word, but after you've given that little bit of a pause. Community members can do a lot of things also by reducing the questions, and family can do this as well. Rather than asking a lot of questions at once, just ask the one and just simply wait for that to come back. For families, routine is very important. And one of the main things also is never speak down to the person, whether it be the family or the community. Speak to the person themselves, get eye contact. Don't talk about them. Don't say, well, what do you think Fiona would like? Ask Fiona, ask her directly. That's one of the things that many of our groups say they find quite insulting. They'll say, excuse me, I'm still here, or I'm not deaf, I heard the question. And then you'll find that they will be embarrassed and maybe not quite so willing to answer. It's certainly something that my grandparents found very difficult. So that was one of the few suggestions. Happy to come back with some more. Maybe Michele might like to add some.
Yeah, sure. Thanks. Look, I absolutely agree, Fiona. Having patience and giving the person time to really both comprehend as well as process what's being said. And, when there's going to be a difference between someone in an early stage to middle stage to late stage, everybody's interpretation and the impacts of their personality and as individuals is going to make every situation different. So I think the best thing I would suggest is just meet the person where they're at and what the circumstances are. So if you're in the community, for example, try and do things in a routinely way as much as possible so that their level of anxiety and frustration doesn't escalate. I mean, and I'll give you a really clear example. Parking in the same spot that you always go to makes that place seem familiar to that person, and that helps them to feel secure. But other people may not respond in that way, and I think that the key really is that person as an individual, what's going to make it a good experience for them. When they're experiencing memory loss or confusion, then it's really and as a carer supporting somebody, sometimes it's hard to detach yourself from that emotion of annoyance when you're in the throes of something. And you know, even I've experienced this with my own mum, you know, that sense of almost embarrassment because something blows out of proportion quite quickly. And, you know, you've got to really separate the disease process from, you know, what you're trying to achieve. And we don't want to limit people from enjoying community and getting out there. And that's the whole point of, you know, having a dementia friendly community and having, you know, everybody raised awareness of what it means. You know, we've got to be welcoming in so many ways these days. You know, we've learnt the last 18 months that COVID has made us, you know, even more socially isolated. So even more reason to try and support somebody, you know, out in the community. And at home, it's easier, I suppose, because you have routine at home and, you know, sticking with that so that the person does feel comfortable, I think are really simple things that everybody can do. But, you know, carers, I know, can find it challenging to support somebody, but, you know, it's, you know, day by day, one day at a time, as they say.
Michelle, it's interesting you talk about that embarrassment side of that for the carers, and sometimes it's the person as well, but with dementia. And I think that, you know, I think there's a lot that the community can do to help that, and, you know, it's by just, you know, I can even, you know, remember, you know, being out with, particularly with my grandmother, and she was very, you know, nobody would have probably known, but she'd do something and it would be, or she'd, you know, if I was with the children, she'd sort of have a bit of a go at the children who were just doing children kind of things. And I'd go, oh, it's all right, Grandma. But, and, you know, it was really about how everybody else was perceiving us. And I think that that is not uncommon. And I think if communities can sort of say, oh, you know, it's all right, and roll with it rather than making people feel uncomfortable. I don't think anyone intentionally makes people feel uncomfortable, but it can be, you know, quite distressing. And it can stop people going out because it's so distressing. And I think that's where that isolation starts as well.
Definitely.
And that kind of brings us into the next one. Oh, sorry, Fiona, were you going to say something then?
I was just actually going to give an example there. When we started in 2018, we were in a public cafe, as a community cafe. Lots of young people who had never come across anybody living with dementia. And that's the perfect example of, you say that people never want to sort of make anyone else feel uncomfortable. They didn't, but they had a lack of understanding at the beginning. And you found that after a couple of weeks and chatting to them offside and suggesting the things we've just talked about, they then had awareness, everything slowed down, and it was so much more enjoyable for everyone. So the coffee was purchased in a happy way, which then led on to a conversation. And so that's the benefits. And this is why we want the community to be dementia aware and dementia friendly. So I just thought I'd mention that one.
Yeah, no, that's a great example too. And that people, as you said, people don't intentionally want to make anyone uncomfortable. But yeah, if you actually understand that how you're reacting, and that example in your cafe, and I've had similar examples in shops where the music's really loud. And that just completely blows their minds, and it again limits where they'll go, because you're not going to go into that shop again because the music's really loud. So there's certain places that people just don't go, and that whole busy shops and busy environments can be so overwhelming. And so just, you know, being able to have a calmer environment. I often think, I know my local supermarket, I think it was Coles that did it, or Woolworths, one of them, and they were doing morning shopping for young people with ADHD, so that they could, so it's a very calm environment. They don't have the loudspeakers, they don't have the loud music. And I think we probably need to look at something similar for people with dementia, because you can then go out and do your shopping without having a whole lot of noise around you, and, you know, there's not lots of other stimulus that upset people. So is there anything else that you can think of that the community could avoid doing or have you anything you've seen that you kind of go, oh, wish you didn't do that?
Look, I think from my perspective, and it wouldn't matter if it was somebody with a autism spectrum or somebody living with dementia. I mean, if community just educated themselves and raised their own awareness, be responsible for themselves in understanding. And we live in a society where not everything's perfect, and COVID certainly taught us that there are some real challenges, and the protocols and all the requirements to just get out in community at the moment, it's so compounded from a person with dementia's perspective, their family, their carers, and we don't want to isolate people even further. So I would say, embrace the difference in the individual and allow people to just do the things that they need to do and live their lives well. I mean, that's what it's really about. So
it is. It's exactly what it's really about. Can you just suggest any other things that might contribute to a person appearing to be confused out and about in the community? I mean, I've just mentioned the overstimulus thing can be a real problem, but any other sorts of things that might make it more difficult for someone with dementia?
I think not only the background noise being very demanding, that can be very difficult for people also just with hearing issues. I think also in a group setting, having one conversation. Now, the one consistent thing that I've heard from my grandparents and from friends and from our wonderful group at DCaf is, if there's 4 or 5 conversations going at once, they find that rattling. It's that bring it all down to one thing to focus on. I've noticed a huge difference with that. And that can be hard if you've got a variety of people.
It can be. Actually, I've just had a message here from Vanessa, who's an audiologist, and she said that she's found over the years often dementia and hearing loss go hand in hand, and that when we address hearing problems, we can really help with cognitive function and communication. And she's asked, are hearing tests routine in the process of investigating dementia in an individual? And, I don't know the answer. I don't think it is.
No, I don't think it's a routine thing, but it's certainly something I would always suggest. And thank you for bringing that up, Vanessa. You're quite right. And it's the same with, a person that may be experiencing an infection. A UTI is really common too, that can sometimes escalate into much more serious sort of health conditions, as we know. So, understanding if someone's a little bit off or to what they normally are, then sort of trying to eliminate those sort of health or medical issues that could be contributing, such as a hearing loss. So now, I mean, something simple like cleaning someone's glasses, for example, can make such a huge difference when you're out in the community or even in the home, being able to locate things with clean reading glasses. Yeah. Lighting in sort of large shopping centres, can have a huge impact on a person. Sometimes look, I'll tell you, I remember taking my mum to one of the Sydney museums, and the lighting in some of the displays was so dimly lit and dark that it was distressing for her. And, just they think it's a great way to present, these things, but it's not actually that helpful for some people. It can be very distressing, being in a sort of a darkened room, not being able to hear or see what's going on. That can be very challenging for some people. So there is a lot of things, and simple things that we take for granted. If we were going to make a difference for anyone with dementia, we would not think about how we perceive it, but potentially how are they going to perceive it. And if they appear distressed, there's something not quite right. So let's investigate.
Yeah. And look, Sandra's also just mentioned around having potentially hearing tests, but eye tests as well. And I think it's something that we all take for granted that, yes, I haven't had my eyes tested for a while, must get them done. Or you might notice all of a sudden things are, having to hold them at arm's length a bit more than you were before. So, it's time to have them checked. But someone with dementia might not notice that. And all of a sudden they're just not seeing as well. But they're not necessarily understanding that that's what's happening.
Yeah.
So probably looking at regular eye tests as well to help.
And this there's another thing that really comes to mind too, as well, is understanding the type of dementia the person has. That can have a huge impact on the symptoms or the signs that they're displaying themselves. So, you know, somebody with challenging language, who cannot verbalize things, you know, can be just appearing confused or you know, distressed, but it could be that they can't get the words out. So there is so much to consider, and it's not sort of very, you know, I'm not trying to sort of oversimplify things, but there's a lot of things people can do that can make such a huge difference in making their experiences, you know, enjoyable.
I think patience is probably the big piece.
Yeah, definitely.
Hem has just put in the chat around the Professor Sue Curl, who spoke on our webinar last week, mentioned a link between hearing loss and dementia. So that webinar from last week, if you didn't see it, will be also on our website in the next couple of days. Heather's also just put up here a question, transport. So I think that's another interesting one, especially for people who have been regular users of the public transport system. And so I feel that frequently, if we had, and bus drivers, you know, bus drivers drive the bus these days, you don't even really get to speak to them anymore, unfortunately. But you know, sometimes they will be, you know, extreme. They'll get to know someone on a particular route, and they'll know where they get on and where they get off and that sort of thing. But it's not, sometimes it's the other people on the bus or other people on the train that aren't necessarily familiar with that person, and just again having some patience and understanding it might not have dementia, they might just be having a really bad day and can't remember or haven't slept properly or whatever. You know, we all have bad days, so I think that's you know, quite a important thing to keep in mind, that, you know, patience doesn't matter whether you have we're not going to have dementia written on our forehead. It's
No.
going to have to be, it's not that easy to locate, but yeah, everyone has days when they might just need that a little bit of extra patience.
I think, Donna, you bring up a really good point too about our, you know, emergency services and our utility workers, you know, be they bus drivers, train drivers, paramedics, police, anybody that's involved in community sort of delivery of service, they should have really very good initial training, you know, to sort of support their understanding of what it's like to live with dementia. And so that then would build on a framework of policy change. And I mean, look, it's all interconnected, you know, to be able to improve experiences for somebody living with dementia, we need to get it at the sort of at that service level, no matter where they're experiencing, because they're entitled to be in community no matter what. And so we need to have this, it's a broader sort of discussion, I think.
Yeah, definitely. And we will work on that more broadly, I think, over time, all of us. But we
will.
So I'm just going to move on. We're in our discussion for all of the people that are listening, in our discussion about today, what we wanted to talk about. We'd had a lot of discussions about what changed for the person and their family members when they were diagnosed, or if they just had started to have some memory loss issues. And so what we wanted to talk about a little bit more is around how you could really work at helping to communicate with someone. And that frequently, sadly, often family and friends drop off once there's especially if there's a formal diagnosis, which is until there's a formal diagnosis, it's just, oh yes, they keep forgetting things, or they keep telling me the same story or whatever. But often people are a bit frightened by the formal diagnosis, I suppose. So we wanted to talk about what sort of things you could do to help keep the communication open and flowing for the person with dementia particularly, but also for their carers, whether it's husband, wife, daughter, neighbour, son, whatever. Really important to see what we could do to help with the communication. So my first question to Fiona and Michele is, what should family and friends consider when they are communicating with that person? I know we've touched quite a bit on this, but I don't think we can do this enough. to really get it across.
Mm.
So what sort of things do you think they could consider?
I think maybe to encourage communication, identify issues that are important to both the person living with dementia and the carer. You talk about bad days. Carers also have bad days, and it's a case of acknowledging that. What we try and do in our social cafes is we try and get people to chat about anything, whatever it happens to be that interests them, because that lightens the mood, it gets people talking, it builds on communication. And anything apart from dementia, we find a lot of people don't actually like to talk about dementia. They say they live that 24/7. They want to come out into the community and talk about something else. So it could be holidays, their family, their pets. It could also be talking about what sort of things do you like to do? What would encourage them to come out and communicate more? There's so many things out in the community. If only they have the courage to go out and explore them, and they feel confident and they feel accepted when they go in. There are sporting groups, gyms, art, music, a wide variety of things. But I think you need to start at what is interesting them and how you're going to get them to talk.
Fantastic. Michele?
I think if I was going to say anything about communication, and it doesn't really matter if it's a friend or family member, I think giving the person time to understand what's being said would be really key. And Fiona's touched on that, you know, not asking too many questions to sort of really bombard that person. You know, and it's not helpful sometimes to repeat the question and just say it louder because you think they've missed it. You know, not everybody living with dementia has a hearing issue, but some do, obviously. But it's just interesting, having grown up also with a sibling that was hearing impaired. You know, everybody just assumed, I'll just speak louder and she'll get it, you know, but it doesn't happen that way. And so, you know, one question at a time would be good. Stop and check, you know, make sure that there is a recognition of understanding. And if there's not, then maybe just, you know, reword the question, but don't confuse it by changing it, because it's just going to compound things a little bit better. I always find, you know, giving the person eye contact and smiling is really helpful too. You know, just that sort of, that warmth is really felt in the body language, and a person who may not understand the words is certainly going to understand how you are feeling. And you know, if you have a warm, friendly smile on your face, then it's more inviting than if you're frowning or you're grumpy. So I mean, these are really basic, and we do this with our own children growing up. You know, it's not much different to being able to sort of build that sort of rapport. I think family members, as already has been said, carers in particular can find things quite challenging. And it's okay to take a deep breath and leave the room if you can't do it. You know, come back to it, you know, if it's just not working. But, you know, building that rapport and communicating about that person's interests. And that's why knowing the person really well is such a key thing. Understanding what their interests are, their history, all that sort of stuff, it's all connected. And so you're going to be able to best support them when you understand them the best. And then you can, you know, you can engage quite well, I think.
Thanks, Michele. The body language thing, I remember doing a lot of training with aged care staff around the body language and positioning yourself in front of the person, not standing over them or behind them or looking down on them, really sitting in front, preferably if you could looking up slightly, because it just puts you in a different position. And the smile, of course. It just, it doesn't matter what language you speak or whether you can speak at all. The smile does do a lot.
I actually saw a care worker the other day who had a mask on her face, but it had a big smile on the face. So how good is that? You know, that you immediately see it and you sort of, it breaks down the barriers. So I mean, there's ways around it. Sure, masks are a necessary evil in these times, but you know, just seeing that made the person laugh quite loud. It was funny.
Yeah. That other thing with regard to masks that I've forgotten, I was in a shop the other day with an older gentleman in front of me, and I'm sure I don't know him from Bar of Soap, but he could not hear what the girl across the counter was saying because of the mask. So I think that's another part of what we now live with, but something to be extremely mindful of.
Yeah.
For everybody. Let alone people who may actually struggle with the conversation in the first place.
Yes, definitely.
Yeah, and I think the short question and one question at a time is a biggie, isn't it? Because if you ask them multiple questions in a row, there's no way they're going to remember everything you've asked, let alone what the answers are. But we talked earlier about patience and giving them time to put their thoughts together and find the word. Sometimes they do want you to find the word, but most of the time they'd like to do it themselves. So giving them time to just don't rush them too much. Other barriers that we find that you've seen with people with dementia, being able to speak for themselves. And we've just talked about the mask issue, but there were other things too that we've discussed. Fiona, anything that comes to mind?
One of the ones that I've come across a couple of times, which I have to be honest, came as a surprise to me, was often they will, as they, not so much in the very early stages, but as they're progressing, they may lose their second language. And if they've come to Australia, that obviously English is their second language, and they may start reverting to their first language, their childhood language. So you'll find a sentence will go along, and then there will be maybe a couple of German words or a German phrase in there, or an Indian phrase. And it's a matter of just simply pausing and accepting that and letting the conversation go on. And most of us can fill in from a conversation what some of those words were that they were missing. We did find that. We also have found it's very easy for the carers always to answer for them. And it's very hard to actually ask that carer not to. And that comes down to the patience and the waiting for them to speak. So they're just a couple of the things that we found. Also, a carer of young people. These two, brother and sister, are in their late 20s, early 30s now, and they had childhood dementia. And Mum said one of the things that she found was not so much when they were small children, but now as young adults, they will often have head speakers on with music, because that is taking away all the distracting noise from the background and is allowing them to focus. So that also can be a bit of a barrier, because some people may think, well, but maybe that's rude or they're not listening. For them, it does make it easier.
Interesting. Very interesting. Michele, anything else you can think of from that perspective? I know we did talk about the fear and anxiety, but also...
yeah, look, I think I'd be remiss of me not to mention the barriers that COVID has placed on people living with dementia. And the obvious ones to me are, mask wearing, inability to hear. I mean, if you've got hearing aids that aren't working and your reading glasses that aren't working, you've got a barrier to begin with. But every time you go into a Service New South Wales centre and there's perspex barriers up in front of you, so there's another barrier. The rules and regulations change almost weekly in this state, so it's really hard. That's a big barrier, I find, for anybody, that even those that are not living with dementia, sometimes they're not understanding that the rules are different, and even explaining to them, they don't get it. And I actually was quite pleased. I was in a Service New South Wales centre the other day, and this gentleman who was going in for his driving test, and he didn't necessarily have what I would deem early stage dementia, but he had hearing issues, and he was Italian speaking. So they saw him coming, which was, I thought, wonderful that they'd met him at the door, you know, and he was ushered in quite quickly because they knew he was coming, and, you know, he'd had a book test in. And so they were able to sort of support him because they'd planned ahead. And so that's, I suppose, to fix a barrier of you know, things that happen by accident is do plan. You know, if you've got somebody you're supporting, then plan what you're going to do, understand, you know, the travel route so that you can know where to park and all these sorts of things. I mean, it's a bit like Pandora's box, really, isn't it? You know, once you do you know, trying to break down one barrier, there's about 5 behind it. But you know, that level of fear and anxiety because of COVID changes and rules is a big one. Another barrier might be seasonal for a person with dementia. For example, you know, not being able to regulate your body temperature, being too hot in summer and being too cold in winter. You know, sometimes people don't have the ability to regulate this themselves. So, you know, to help make them more comfortable, you know, overcome those things for them, I think would be a good thing. I mean, I'm sure there's many more that, and the audience themselves will have a lot of examples, but these just sort of come to mind.
There's a great, lovely one here. There's a couple of comments and questions. Vanessa's just mentioned about communicating. It can also help to put your voice into a lower register, so not too shrill. And I've had that comment from residents I've looked after about particular staff members who have quite high-pitched voices that they can't hear they don't understand what they're saying, and that's actually not with dementia, that's just generally.
Yes.
So and this can help to carry your voice through a mask as well for people with hearing loss. So that's a good tip. Thanks, Vanessa.
Great hint. Yeah.
Another one, and this is a question from Carolyn. It's about the types of questions that are best to ask to engage with an individual. For instance, I find, what have you been doing to be stressing for my person, as they don't always remember. So any tips that might be helpful for that?
I think what you're doing is too vague.
It is, it's too vague, exactly, yeah.
And that comes back down to knowing, if you can, knowing the person, maybe even having some knowledge, even if you've got a hint from the carer, you know, what actually has occurred in the week, so you can then ask a more specific question.
Like the grandchildren, I heard the grandchildren came this week. What, you know, how were they? Just that sort of opening it up rather than the closed, what have you been doing?
And never say, do you remember? Never.
Yeah, definitely. One of my classics, I have four mum and three aunties, and all of them, 3 of them would ask my grandmother always, they'd test her around whether she knew who they were, and it was heartbreaking to watch. And eventually I just pulled them all aside and said, you can't do this. Don't test them. Tell them who, you know, and they all sound exactly the same, and her vision wasn't great. And I'd go, you know, you're too similar. Just tell them, say hi, it's, you know, and take that, don't make it hard for them. But yeah, that it can just be a bit, it was overwhelming for her, and they would take it to heart that, you know, mum doesn't know me. And of course she knew them, but it was awful. So Michele, any other comments there around you know, other questions that you'd suggest?
Well, I think if you're going to sort of try and relate to the person, you know, look, and it depends on the setting that you're in, I guess. You know, if you're in a home environment, use what's around you to draw that person out. They've obviously been in that room many, many years probably, and so there's going to be a family picture around the room. You know, compliment them or ask them a little bit about the couch that they're sitting in that might be new. I mean, there's so many things that you can make it easy to sort of improve that communication. But, you know, it does depend on the person. It depends on the setting, you know, how you want to engage. I mean, there's a lot of things that we can say to complicate everyday things, but, you know, and giving people simple choices too, not saying, oh, we can do this today and we'll go out for lunch and we might have such and such at a cafe, restaurant, you know, and that's overwhelming for anybody. So, you know, just do a staged process on how to, particularly if you're looking for their input about what they'd like to do, you know, just keep it to what you want now and then move on when the time's appropriate. That's what I would suggest.
No, that's a really good hint, actually, because we can be a bit too descriptive at times, can't we? Yeah, definitely. The last question that we were going to cover, and I'm just mindful of the time, and there's more questions coming up, was just around what we can do to support communication with the person and their carer. And I think we have touched on most of that. I think trying to focus a little bit more on the person's ability rather than their disability.
Mm-hmm.
And one of the things I have noticed with the many people that I've looked after over the years with dementia is that they may not remember what they had for breakfast, but they can tell you all about what happened in 1932. And so, you know, there's not, you know, that reminiscence side of conversation and communication can be very heartwarming for them, and interesting for you to find out more about those people. And sometimes you might hear the same story a few times, but generally, if they're reminiscing, it's good for them to reminisce and talk about their time. I've just found a couple of other questions. I'm just going to go back to how this is from Kathy Ricard. How do you know when a person with dementia cannot live on their own anymore? Oh, that's a big question, Kathy. Does anyone want to try?
That is a really big question, and I can recall when my own mum was sort of advancing in her disease, and you know, I asked the same question of the nurse that was you know, that we were consulting with at the time, and she said to me, look, you'll know when things need to change. And I said, well, how do you know? And you know, it's a very personal question, and it depends on a lot of contributing factors. And if you're a working carer, I mean, for me, I was a daughter, you know, with my own family, and I needed to make a decision about, you know, just getting some extra care. That was like the first step. And so it's not always like one or the other. Sometimes there's staged processes to go through, such as getting, you know, community support, or, you know, getting services in the home. And that can be very challenging for people anyway, because, you know, not everybody's comfortable with having complete strangers in their home. This is a real transition thing. So it has to be workable for you, but you have to, I think, be kind to yourself as a carer and as a family member, and know that, you know, there are a lot of things out there to support you and your family member. And, you know, when you can, when you can't keep all of the juggling balls in the air at the same time, that's probably a good time to let one or two of them go so that you can manage better. That's, you know, that's what I would say about that.
And I think my only comment about that would be around safety. So if the person is living on their own and they are either they are wandering in the night and clearly or across, you know, not able to cross roads on their own, or if they are leaving the gas on, or any of those sorts of things, that the safety is probably the things that to me would be the trigger. Fiona, do you had something else to say then?
Yes, I can actually relate. For me personally, I was in my early 40s. I had grandparents. It's very hard when it's your partner. It's hard when it's your parents, but trust me, it's even harder as a granddaughter to say to their grandparent, the time has come, we really need to move Granny into some sort of care. And my only suggestion would be is don't be afraid to ask for help. You know, you've got so many in Northern Sydney, there are so many excellent, there's ACAP, there's the hospitals, wonderful support networks. And yes, it was a safety issue. And finally, I won't go into all the details, but as I'm tearing my hair out with teenagers saying, Mum, you've got to do something, I'm going, I know. A husband who works away, a grandfather who said, no, this is what the husband does, he looks after his wife to the end. And And yes, it was a safety, and it was awful. And it was the middle of the night, and you just call in help and let the professionals deal with it, and then work your way through. But yes, you do know, there is no doubt about that. I've seen it numerous times since. The carer knows that there's a big difference between knowing and being able to move to that next step.
Yeah.
So my comment would be get help.
Get
accept help.
Accept help. Yeah.
Mm.
I think none of us grow up expecting that we're going to have to deal with dementia. No, not the person with it, not their family, nobody. So I think it's something that you have to prepare yourself that you're going to need to accept help at some point, whatever that looks like.
Mm. And often the person living with dementia is often the rock of the family. Yeah. You've gone through generations where this is the person you look up to. Yeah. They solve everything. Yep. So it's that changed circumstance of, oh, you're not looking after me, I've got to look after you. You know, you've got to be able to move forward and be the decision maker. Definitely.
There's just a question here from Natalie about delirium, and I don't want to really go into delirium too much here, but she's asking around what's the best way to respond to someone in a state of delirium. So delirium is not generally a permanent state, but it is around, you know, what sort of a conversation to have with them, and whether to try and tell them that something that they are seeing or feeling is real or not real. And I certainly have had this experience with a gentleman who, when we had an electric fireplace in the dementia wing that I worked in, and if we couldn't actually turn it on while he lived there because it evoked a lot of memories from when he was in the war. And so he would get quite frustrated, and it didn't matter. There was no amount of discussions with him was ever going to change that. And I think sometimes we really want to bring people back into reality if they're thinking that something is, you know, in particular under delirium, but sometimes in a dementia, people might be telling you something that's happening that you know it's not happening. You know, the sky is not falling or whatever, and how hard to work to get them to reality. Any thoughts on that?
Look, I think a person's reality is their reality, whether they're suffering from, you know, the impacts of delirium, if they're unwell, if something else is going on that's changed or altered their behaviour. I think you've got to kind of play into their reality at the time. And certainly if there's a suspected delirium, you know, seeking medical help as quickly as possible would be, you know, pretty important. But yeah, look, going with the flow is probably a good thing. If they're already agitated, you don't want to agitate them more by contradicting them. So I think it's important to just, you know, calm them as much as you possibly can. And as long as you're calm, then, you know, things shouldn't escalate. But, you know, every situation is going to be very different.
Exactly. So listen, we've only got about 3 minutes left for this webinar, and I'm going to share my screen again because the Northern Beaches Dementia Alliance has actually developed a communication card. Can you see that, everybody? Hold on a minute. Going back to the beginning, which is not what I wanted. So this is the communication card, and this is a card that we are about to have printed up, and we're going to have distribute it through council and through the local businesses and things for people to actually really think about what they're doing when they are communicating with somebody, to be a bit more dementia friendly. And, you know, the things that we want people to think about are written there around dignity is important, and acknowledging who I am, and, you know, not just talking to my carer as we discussed, empathizing with me and treating me as you would like to be treated, make eye contact and smile. And I think that alone will get you a really long way. Eliminating background noises to help me focus. Navigating may be challenging for me, offer assistance. Treat me with courtesy, respect and consideration. And if I seem confused, reassure me. assist me with money or bank cards and counting my change back to me. Find words that prompt my memory if I forget. Repeat your questions if I don't answer. If I'm slow to answer, ask if I need help. Explain information simply. Use short questions. Never make assumptions. Dementia is different for everyone. Don't rush me. Take your time and be patient with me. Listen to my concerns and requests, and your small actions can make a big difference to me and my carer and family. It's not written on there, but it definitely does make a big difference. So these communication cards will be available, a soft copy will be available on the website. I think it actually is already on the website, but we will also be making them available. If you or your business or your community would be interested in having any, there is an email address on the website if you want to send us a message and we can get some to you. And hopefully you can help us to make our Northern Beaches area more dementia friendly. There's another 3 webinars in this series, so please have a look online and see if you can book in for them. It's been lovely seeing you all. Thank you very much, Michele, and thank you, Fiona, for your wise words today. Appreciate that.
Pleasure.
Take it easy, everyone. Have a lovely day.
Thank you.
Thank you.
Thank you, everybody.
Bye.
Thanks, everyone. Bye-bye.